Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi R, who is the past president of IMA Udupi and Karavali and the present president of Gynecology Society of Manipal. And more than that, she is a very popular obstetrician and gynecologist and also a writer, a prolific writer. She has written many columns to bring awareness among the public and also written a book, Vatsalya the Vosuge, to teach the women how to take care of their health. Today, she is here with us to talk about the vaginitis and the white discharge. Welcome, Dr. Rajalakshmi.
Thank you, ma'am. Thank you for the opportunity.
Many women, they will come with the backache and the white discharge, and it's so common. I mean, almost half of them they suffer. And apart from that, the anemia is also very common. And what is this vaginitis, and why do they get it, and how they have to be take care of that?
Okay. Any infection in the vaginal area. Vagina is called vaginitis. So, how is it noted? What are the symptoms? They'll have some discharge from there. So, usually a lady has discharge prior to her periods and during ovulation. Other
Yes.
than that, they'll have some discharge. It might be watery, it might be greenish in color, it might be with some smell, it can be thick, curdy white discharge, it can be there. And there can be itching. There can be severe pruritus. So why does this happen? Uh, the vagina has its own defense system. The pH has to be maintained between 4.6. That is by the lactobacillus. When this lactobacillus gets washed away, the vagina gets infected. So it can be due to either
No, I
bacteria.
thought this lactobacilli is there in the, the intestine, because that is the one which maintains the intestinal flora. So that is there even here in vagina.
Yes, ma'am. There is slight difference in the intestinal flora and the vaginal flora. The microbiota is there in both the sections. The lactobacillus dominance is more in vaginal flora, and intestinal flora is slightly different. So both are there. Both places, the bacteria, the helpful bacteria are always there. So if that is altered, it can be due to some bacteria, or can be due to fungus, or can be due to virus like HPV or herpes simplex virus, or can be due to some protozoal infections. So all these alter this pH and cause the infection. So along with this, the discharge, pain, and they complain lower abdominal pain. There can be backache also, and they'll have itching. So these are the common symptoms they have.
Now, since the common symptoms are there, they also know it's a white discharge. You also know white discharge. But what examination do you do, and how to decide whether it is a viral or bacterial or fungal or protozoal? How do you make out?
Yes, ma'am. Very good question. Because people usually come and tell us we are having white discharge, you give us treatment. And they're very shy to get examined. But it is always I tell them that it is you have to get examined, because we have to differentiate which cause is causing or giving us the problem. So we do this examination is called as per speculum examination. We do the local examination of the vulva, whether there are any ulcers there, any rashes are there, that we see, and then we do a per speculum. In per speculum, we see the vagina and the cervix. So even in some cases, when we do this examination, the discharge can be due to some abnormal growth in the cervix, like might be a polyp. That also can be diagnosed. There can be some erosion on the cervix.
And then the discharge will be reddish, and it will be blood stained because of the ulcer and erosion.
Ulcer, yes. And it will be watery if it is a chlamydia infection.
Like curds. Like curds, it will be white and thick.
White, yeah. It will be like flakes. Curdy white flakes it will be. And when we can't diagnose, we have some specific tests for it also. We can take the white discharge and test it under the microscope to diagnose trichomonas and chlamydia infection. We can do a vaginal swab culture to see whether it is fungal or bacterial. We can be done. And we also do a infection, because most of the time, 80 to 90% of the women have once or twice HPV DNA infection in their lifetime. 99% of the time they get cured, but only in 1% of the time they can go up to, it can get transformed into cancer. So we
Cancer.
also do,
Yes.
when they come with repeated discharge and infection, we do a pap smear and HPV
And that's
DNA
why to
analysis.
avoid all this, even before they get married, we have started giving the vaccine to that.
Vaccines, yes,
Yes,
we have
yes.
started giving the
Yeah.
vaccines.
Okay.
Yes.
Now that you have decided, what sort of treatment is there? Is it the orally to swallow or to keep there as like a suppository or a cream? What sort of treatment do you give?
It depends on the severity of their infection.
Hmm.
Usually, if it's a local infection, we prefer to give a local vaginal suppository so that they don't have any side effects. But
Okay.
sometimes they are scared to use that. They think that it can get displaced and go somewhere else. No, it
Okay.
doesn't
No,
happen.
no,
It
no.
helps there to cure the vaginal
Okay.
infection.
Okay.
And if the itching is too much, we do give them some creams to apply. And antifungals and antibacterials will be given to take orally. Along with that, we give them some suggestions. One is to maintain their hygiene. Whenever they are in menstrual period, they have to keep on changing their pads every 4 to 5 hours. Keep themselves clean. If they are using the menstrual cup, the cup should be removed every 6 to 8 hours
Okay.
and cleaned.
Okay.
And while cleaning also, they have to clean from the urine side downwards, not
Okay.
from below upwards. If we do the below upward method, the bacteria, E. coli, whatever is there in the
Whatever
intestines
is
will
there
come up.
in the yeah, motion, that will come into this. So E.
Yeah.
coli infection also can come. Okay.
Yeah. So we tell
Okay.
them to clean the proper method of cleaning. And
And the
after
water
clean,
jet has to be from front, not from the back.
not from
Yes.
the back. Yeah,
Yeah.
especially.
Okay.
Correct, ma'am. Yes. That is also causing repeated infection nowadays. And once washed, it's better to pat dry, not rub and dry, just pat and dry. Because if the
Okay.
moisture remains there, especially if in the rainy season, if your undergarments are not clean and not dry, or in the summer season where you sweat too much, usually the fungal infections are seen. So you have to keep that area dry. Don't use any harsh liquids like Dettol or very hot water or any inti wash or V wash, not needed, because excessive use of this wash lotions, vaginal washes, intimate washes will cause the depletion of lactobacillus, and again the infection will be there. So not to do that. And we always advise them to avoid sexual intercourse during this time to prevent the infection from getting transferred to the
Yeah,
partner.
from husband she would have got the infection, and then again she'll give it back. Almost
Yeah.
like playing ping pong, he gives her and
Yes.
she gives him. So
Yeah.
it goes
Okay.
on. Okay.
Yes, and the most important part is if they are a married couple or if they are in a sexual relationship with somebody, it's better that their partner also gets treated. Otherwise, they will get repeated infections.
Okay.
And most the
And
other most,
unnecessarily they'll blame the doctor that the doctor is not giving proper
yeah.
treatment, it is not going. But actually it is not going because they are again getting it from their husbands or
Yes,
spouses.
and
Okay.
we prescribe it for a duration. The full course has to be taken.
Okay.
Otherwise, they can have the again relapse of the infection. So full course has to be taken,
Okay.
and they have to rule out if they have any sexually transmitted infection and all. Some people say we are using condoms. So how can we get infection? Yes, condoms prevent sexually transmitted infection,
Yes.
but the lady might be, sometimes they have allergy to that latex whatever material. So in there also it is not infection, they can have some burning sensation and
Allergy,
some
burning sensation, and
discharge.
the itching and can be there.
Yeah,
Okay.
discharge will
Okay.
be there. So
And
that also
suppose
be
there are
looked in.
some ulcers on the cervix or something, or the polyps, you do the surgery also? Just
Yes,
because it
ma'am.
is white discharge and just medicine or the suppository is not enough.
No, if
Yeah.
there is a ulcer on the cervix and all, we might do further tests like
Biopsy
colposcopy,
and yeah.
then biopsy, and then we treat them
Hmm.
accordingly.
Okay.
There can be ulcers on the labia, ma'am, the outside of the vagina. That is
Okay.
usually seen in herpes simplex infection. So in
Okay.
that case
Viral
also
infection. Yes.
yeah,
Yes.
we have to treat both the partners. We has to be
Mm,
treated.
mm.
If
And also sometimes, when they try to shave the hair, they also get infected, no? That part.
Yes, sometimes it happens. Usually, to maintain the hygiene, when we say you have to be clean, they use the razors to remove the hair. Sometimes they reuse those
Yeah,
razors,
and
blade.
that
It
also causes
Yeah, it
infection.
can be rusted,
And
and
barber's
sometimes
itch,
you
like
can't see
barber's
the
itch, yeah.
you can't see the direction in which direction you are using it, so that can injure the root hair follicles. Root can be injured, and there can be some boils or
Cut in the skin
infection
also,
can be
yes.
there. So the best thing is not to use any depilatory cream or scissor this razors. You can just trim them with a scissor. That is the best option to maintain the hygiene.
Okay. Now, finally, what are the tips that you would like to tell? 1, 2, 3 for preventing the white discharge and treating the white discharge.
Okay. White discharge slight amount is normal during your peri-ovulatory period and just before the periods. So you have to maintain your hygiene. You have to be clean. That doesn't mean you have to be over clean. The general health should be good. There should not be anemia. Anemia has to be corrected. And whenever there is an infection, both the partners should be treated. Last but
Together
the
at the
most
same time.
yeah, at
Otherwise,
the same
if
time.
one takes and the other one takes afterwards, they would be infecting each other.
Continue. And one more thing, the most important thing, we usually neglect it. We have to be mentally sound. If there is a stress, subconscious stress also, that manifests. Usually I have seen in my this thing, they simply come with pruritus. And the most common place the ladies say itching is in the vagina, in the private parts. So, and that too, it's more in the night. Okay. So these usually seen maybe in the perimenopausal period also. When the estrogen comes down, they are reluctant to have intercourse. And this is a common symptom they come with. This thing. So mind also has to be sound. If there is any stress, that stress also has to come down. So physical and psychological health both should be optimum.
Yeah.
Then
healthy mind in the healthy body with the motto that Shuchitva is Daivatva. Cleanliness is godliness. And that is the motto. Thank you very much, Dr. Rajlakshmi.